Hello, I'm here to talk to you today about how to get your staff passionate about helping patients. My name is Dr. Saahil Trivedi. I'm a recent graduate. I graduated in 2017. I've been an MGE client since the very beginning. I've applied so many things that I've learned here, and it has proved awesome for my practice growth. So I'd like to talk to you today about why it's important to get your staff to be as passionate about dentistry as you are. I know that dentists do what they do out of a place of care. It's not an easy field a lot of the time, right? Dark, wet, sticky, smelly spaces, and you're drilling and you're all in there. But why do you do it? Because you really want to help patients get better. And you know that if a patient has healthy teeth and gums, they're gonna feel better, they're gonna live longer, they're gonna be able to eat better, they're gonna be healthier. It's an awesome field that we're in. But this passion that you see in me, how do you get that in your staff? Because if it's in your staff, it'll go over to patients so much more. So a really successful action for me in my practices is I routinely educate my staff about the importance of dentistry. So I actually have formal meetings with my staff about dentistry, and I found that to be a really successful action. So what do I go over in these meetings, right? We go over the basics of dentistry, what terms mean, the basic definitions, things like that. I show them outcomes and before and after, so they really understand the scope of dentistry and the amazing things that we can do as dentists and providers when it comes to restoring people's smiles, restoring their health, restoring their function, allowing someone to eat something that they haven't been able to eat for years because of their tooth condition, fixing gums, fixing bleeding, fixing bad breath, all of those things. So my staff are very well educated on the amazing things that dentistry can do. They're also really well educated on what can go wrong if someone avoids the dentist. And I think this is the most important part about educating your staff about dentistry, is what happens when someone doesn't get dentistry done. We as dentists know how bad things can go wrong when someone avoids the dentist. We know that a little cavity can turn into a massive root canal, can turn into a huge infection, which can actually spread all throughout the body into the brain, lungs, heart, blood vessels. It can cause inflammation throughout the body. It affects so many bodily systems, right? But do your staff know that? Because if your staff don't know it, it's pretty likely that they're not going to be able to educate your patients on it, right? And a lot of times what happens is patients will talk to and listen to your staff more than they listen to you as the dentist or doctor. Oftentimes, patients will say yes to you, that they understand or that they don't have any more questions. But the second the dental assistant walks in or one of your front administrative staff walks in, the questions come out like a whole list, rapid fire, right? They don't ask you. They ask the dental assistants and the rest of your staff. So it's very important that the dental assistants and your whole staff, including administrative staff, phone staff, everybody in your office knows about dentistry, right? So that's why we do our formal meetings where we go over these dental conditions and what goes wrong and the negative outcomes to avoiding dentistry. And I show them photos and videos, both photos I've taken myself, intraoral camera photos, things like that, and also photos I've been able to find on the internet and from prior dentists and things like that about what can really go wrong. Because unless your staff understand how bad things can get in dentistry, they're not going to be passionately talking about dentistry to your patients, right? Because we talk that passionately to our patients because it's from a place of care. We know that if the patient doesn't get that cavity filled, it's going to turn into a root canal. Or if that patient doesn't get that root canal, they might lose that tooth. Or if they don't get that infection treated, it might blow up and pus may start leaking out of their face. I've seen it happen. I've had cases where people can't open their eyeballs because of their infections going up into their face. We know all these things, but do your staff know these things? Because the second they understand how important dentistry is, how vital it is to overall body health, to someone's confidence, to their function, to their ability to eat normally, to their ability to be healthy, to the ability to manage other conditions in their body, they will start talking to patients about it without you even having to ask them. They will voluntarily and actively explain dentistry, dental conditions, the importance of what you have just told the patient to get done, because they believe in you and they believe in dentistry to help the patient get better. Right? We're all on the same mission to make sure our patients have healthy teeth and gum for a lifetime. But if the staff don't understand what that means and why it's important, they're not going to be able to help you on that mission. As part of our formal meeting, we also have a Q&A session. You would be surprised at the amount of questions that staff have about dentistry, even though they've been working in a dental office for a long time, right? We've all had patients who think of root canal means an extraction, but you'd be surprised at how many staff also have almost basic questions about dentistry. What is a perio maintenance? What is scaling and root planing? How is it different than a cleaning? How does a cavity turn into a root canal? What is an implant? What is a bone graft? I've had all of these questions from staff who have been working in dentistry for years and years, and I've sat down and had to explain it to them. But once they get it, they can talk to patients about it. So it's really important to allow this to be an interactive meeting with your staff when you have this formal meeting. Allow them to ask you questions. You can answer their questions. And also, I would have a formal presentation set up like I do with photos and videos and intro camera pictures and pictures of teeth and infections and diagrams and everything in simple terms, right? It's really important that you explain to staff in the same way you'd explain to a patient, right? They're not clinical staff. They haven't gone through dental school. You don't want to be using big terms with your staff because then they're going to use those big terms with their patients if they understand them at all. So it's very important to explain to your staff the same way you explain to your patients, so then the staff can explain to the patients the exact same way you've been explaining. But it really is a team effort in the dental office. It's very important, I can't say it enough, to have all your staff very well educated on dentistry, not even just dental assistants, but also your front staff, your administrative staff, your phone staff, your receptionists. Make sure they understand dentistry, both from an outcomes perspective, what it can do for patients, how awesome we can make a patient smile, how much we can help them, but also just as importantly, what can go wrong if a patient avoids the dentist, if they avoid dental treatment, if they don't do what you're recommending. Because your staff want to back you up, and as long as they know how to back you up, they will back you up. I hope you enjoyed today's tip. If you want more tips like this, please subscribe. We have awesome content coming up for you. Thank you.